Learning objectives. After completing this module, learners will be able to understand and describe terms related to population, understand and describe the distribution and density of population, understand and describe the causes of population growth and processes of population change, understand and describe age composition, sex ratio and literacy rate of population in India, understand and describe about occupational structure, health issues, adolescent population and national population policy. Population terminology. According to sociology, population is a collection of human beings. Demography, a branch of sociology, deals with the statistical analysis of human population. An official enumeration of population done periodically is called census. In India, the first census was held in 1872. The first complete census was conducted in 1881. Since then, the Government of India has been conducting census at an interval of 10 years regularly. Census gives us a variety of information about the country. Population size and distribution. According to the 2011 census, India's population at 1.21 billion accounts for 17.5% of the world population, while the area occupied by India is just 2.4% of the total world land. As per the 2011 census, Uttar Pradesh at 199 million is the most populous state, and Sikkim at 0.5 million is the least populous state. Nearly half of our population lives in Uttar Pradesh, Maharashtra, Bihar, West Bengal and Andhra Pradesh. Population density. Population density is the number of persons living per unit area. The density of population in India, according to the 2011 census, is 382 persons per square kilometre. Difficult terrain, lack of fertile land, low rainfall and sandy desert affect the density of population. Due to fertile land and abundant rainfall, the states in northern plains and coastal areas of Kerala and Tamil Nadu are thickly populated. In comparison, Assam, most of the northeastern states and peninsular states have moderate densities. Population growth and processes of population change. Population is a dynamic phenomenon affected by three factors: births, deaths, and migrations. Change in the number of people inhabiting a place for a specific period of time is said to be growth of population. India has shown a decadal growth rate of 17.64% in the census of 2011 as compared to 21.54% in 2001 census. It shows a declining trend of population, which is a positive indicator. Processes of population change. Birth rate is the number of live births per thousand persons in a year. Birth rate has always been higher in India. Death rate is the number of deaths per thousand persons in a year. A higher birth rate accompanied by a low death rate contributes to a growth in population. 1981 onwards, birth rate declined due to sustained efforts towards family planning. Migration is movement of people from one place to another in search of livelihood. Movement within the country is called internal migration. Movement to other countries is international migration. Internal migration does not change the size of population but impacts the distribution of population within the country. lack of employment opportunities and poverty are the push factors that compel rural population towards cities. Better options of livelihood are the pull factors in the cities. The urban population has increased from 17.29% of the total population in 1951 to 27.78% in 2001. Age composition. In terms of age, population distribution is studied under three categories. Children below 15 years are economically unproductive and need support for food, education, and medical care. Working age 15 to 59 years. People in this category are economically productive. At 63.3%, they form the highest segment of our population. They provide means of sustenance for themselves and other age groups. Aged above 59. This age group is unproductive economically. Most of them have retired from active life. They might work voluntarily but are not available for employment through recruitment. They need medical care. Children and aged affect the dependency ratio as they are not productive but dependent on the working category for their care. Sex ratio. Sex ratio is the number of females per 1,000 males in the population. According to the 2011 census, the sex ratio in India is 940 females per 1,000 of males. Kerala has the highest female sex ratio, 1,084, while Haryana, 879, and Delhi, 868, have the unfavorable sex ratios. Literacy rate. The definition of literate according to the Indian census since 1991 includes the population aged 7 or more, which can read and write with understanding. India has witnessed a marked improvement in the literacy rates from 65% in 2001 to 72% in 2011. According to 2011 census, it is 82.14% for males and 65.46% for females. Occupational structure. The distribution of the population according to different types of occupation is called the occupational structure. The three categories of occupation are primary occupation, including land-related activities like agriculture, forestry, fishing, mining, etc. Secondary occupation, including activities related to manufacturing, building and construction, etc. Tertiary occupation, including service-related activities like communication, commerce, administration, etc. Most people in developed nations are engaged in secondary and tertiary occupations, whereas in developing nations they are engaged in primary occupation. 64% of our population is engaged in agriculture, 13% is in secondary activities, and 20% depends on tertiary activities. Health. An increase in life expectancy, fall in death rate, and infant mortality rate is the result of improved healthcare system, prevention of infectious diseases, and application of modern medical practices. Yet, low per capita calorie consumption, safe drinking water, and basic sanitation amenities remain issues to be addressed for a wide base of rural population. Adolescent population. Almost 1/5 of India's population constitutes of adolescent, age group 10 to 19 years population. A very significant future resource. Adolescents' nutritional requirements need close attention. Malnutrition, especially amongst girls, is widespread. National Population Policy. In 1952, the government launched Family Planning Program to promote responsible parenthood. The National Population Policy 2000 aims at providing free education up to 14 years of age, reducing infant mortality rate, immunizing children against all vaccine-preventable diseases, prevent child marriages, and spread awareness about family welfare. Summary. Let us summarize what we have learned. According to sociology, population is a collection of human beings. An official enumeration of population done periodically is called census. According to the 2011 census, India's population at 1.21 billion accounts for 17.5% of the world population, while the area occupied by India is just 2.4% of the total world land. Population density is the number of persons living per unit area. Change in the number of people inhabiting a place for a specific period of time is said to be growth of population. Birth rate and death rate bring about a change in population. Movement within the country is called internal migration. Movement to other countries is international migration. In terms of age, population distribution is studied under three categories: children below 15 years, working age 15 to 59 years, aged above 59. Sex ratio is the number of females per 1,000 males in the population. The definition of literate according to the Indian census since 1991 includes the population aged 7 or more, which can read and write with understanding. The distribution of the population according to different types of occupation is called the occupational structure.